We'll begin by looking at heart anatomy and the surface features of the heart. So the heart pumps over 1 million gallons per year, and if you take all the blood vessels, including the tiny little microscopic capillaries, you would have over 60,000 miles of blood vessels, which is quite impressive. So there are two vascular circuits. There is the systemic and pulmonary circuit in the body. The systemic circuit is going to go from the left side of the heart through all your body systems, that's how I remember systemic circuit, back to the right atrium. And the pulmonary circuit is going to leave from the right side of the heart, go to the pulmonary capillaries at the lungs to pick up oxygen and unload CO2, and is going to come back to the left area. So you can see those labeled in red and blue. Generally, whenever you look at a figure, they are going to denote oxygen-poor blood in blue and oxygen-rich blood in red. So we can see that the blue right side of the heart has oxygen-poor blood, and the red left side of the heart has oxygen-rich blood because it's receiving blood that's just been to the lungs. The right side is receiving blood from veins that have been to all your body systems. Arteries are vessels that carry blood away from the heart, and veins are vessels that carry blood to the heart. I remember this as arteries begins with A, so does away. So arteries carry blood away from the heart. So if you look at the surface projection on where the heart is, it's about the size of your fist in your chest. The apex is going to be that bottom point that you see labeled the inferior left point, and the base is going to be that top area between the superior left and superior right points. It is deep to your sternum and ribs and rests on the diaphragm. There is a bit of a asymmetrical area in that it faces more toward the left, and the apex faces the left lung. There's a little cardiac notch in the left lung where it fits in, and the right border faces the right lung. So you can see the heart's projection in the mediastinal area within the chest, and you can see that cardiac notch there in the left lung when you look at the figure on the bottom left. Looking at the layers of the heart wall, you'll notice that there is a pericardium and a pericardial cavity around the heart. You should have learned in your Anatomy and Physiology 1 class the structure of a serous membrane. Every serous membrane has a parietal layer on the outside and a visceral layer that touches the wall of the organ. These are just very thin epithelial layers, and in between them they have a little bit of serous fluid that we're going to call pericardial fluid here that prevents the parietal and visceral layers from sticking to one another. So you can see how the heart fits in that pericardial cavity there. We've got the pericardium around the heart, and then we're going to divide the heart into layers. In addition to that serous pericardium, you also have a fibrous pericardium on the outside made of dense irregular connective tissue so it can resist much tension in all directions. You can see it looks like a kind of opaque glove there around the heart, and there's going to be the pericardial fluid in between the parietal and visceral layers inside of that. So it allows for vigorous and rapid contraction and keeps the heart in its mediastinal position that we looked at a moment ago. So we've got that fibrous pericardium, and touching it is that layer of the parietal pericardium, the serous or pericardial fluid. Then touching the heart layer is the visceral pericardium. So if you had a heart laying in front of you to dissect, it would have a shiny layer, and that's the visceral layer of the pericardium, the serous pericardium, on the outside of it, as you can see labeled on the figure. The majority of the heart is actually muscle. That is the bulk. So the heart is just made of cardiac muscle tissue, but we call that whole contracting layer myocardium. So the myocardium, or the muscle of the heart, which is mostly what the heart is considered a layer. And then finally, if you cut the heart open, lining the chambers and valves, there's also going to be a shiny layer similar to the visceral pericardium on the outside, and we're going to call that the endocardium. So endocardium is another thin epithelial layer, but it lines the inside of the heart in the chambers and valves, and you can only see that when you cut it open. Also, since if we remove the heart out of the body, like we said, you'd have that shiny visceral layer of the pericardium. They call that shiny visceral pericardium the epicardium. Epi means above, so that's the outermost layer of the heart once it's removed from the pericardium. So the visceral pericardium and the epicardium are the same thing. And I like this figure because you can see just a picture of the types of tissues, if you remember from your histology laboratory, that is making up each of those layers. So you can see the dense connective tissue making up, dense irregular connective tissue making up the fibrous pericardium, the cardiac myocytes in the myocardium and the epithelial layers, on the parietal and visceral layers of the pericardium, and on the endocardium as well. We'll first look at the surface features of the heart, but then in later videos we will look at the great vessels and internal features and valves. So on the surface of the heart, as you can see, this is a picture of the anterior heart over to the right side of the screen. There are grooves on the surface of the heart, and we call those grooves sulci. So sulci is plural, sulcus is singular, and these grooves or sulci are for coronary vessels to sit in. Coronary circulation is the heart's own blood supply. The heart is a very active muscle and it needs constant oxygen and ATP production. So it is going to have its own blood supply, and that's what those tiny little vessels sitting in the sulci are, vessels of coronary circulation. Running my mouse over the coronary sulcus encircles the heart like a crown. It goes from the top and it circles all the way around and comes back. As a surface feature, it would separate the two top chambers called atria from the two bottom chambers called ventricles. Running my mouse along the anterior interventricular sulcus, that is going to be a groove that holds coronary arteries and veins that goes down the front of the heart, down to the apex. This, as a surface feature, would divide the right ventricle, which would be found here, from the left ventricle. And then the posterior interventricular sulcus, if we look at the back, can be seen the same way on the back, going all the way to the apex. And as a surface feature, it would divide the left ventricle, as we see here, from the right ventricle. And it's a groove that goes down the center. And we can see how the coronary sulcus is going around the back as well, like we talked about. We said that there are 4 chambers. The 2 upper chambers are thin and small-walled, and they are called atria. The 2 bottom chambers are much thicker, and they are called ventricles, and they are thicker in myocardium because they are discharging chambers. So we can see that this would be the right atrium, this would be the right ventricle, this would be the left atrium, and this would be the left ventricle. You can also see there's a lot of adipose tissue that sit around those sulci to protect those coronary arteries and veins. Auricles are little pouches that extend off of the atria. This is the right auricle that is arrowed here. There's the left auricle on this. If you think about the outer section of your ear, that's also called the auricle. So they look kind of like little ears, but they're really just extension pouches on the atria. So if you look at the chambers and the sulci, you can see the coronary sulcus labeled here, your anterior interventricular sulcus. You can see your right auricle over your right atrium, left auricle over your left atrium, right ventricle from the surface, left ventricle from the surface, right ventricle from the surface, left ventricle from the surface. This is your left auricle over your left atrium, right auricle over your right atrium, coronary sulcus, posterior interventricular sulcus. It's hard to see in some of the figures. Here we see labeled the right atrium, right ventricle, left ventricle. And it is hard to see in this figure as well, but the left ventricle is going to be what pushes blood out to all the body systems in what we called earlier the systemic circuit. So the myocardium around the left ventricle is going to be considerably thicker than the myocardium around the right ventricle. And you can see it best in this transverse view. This would be a transverse view or horizontal view looking down at the myocardium of the heart. And you can see just how much thicker the myocardium is around the left ventricle, pushing blood to all the body systems, than the right ventricle, which only has to push blood to the lungs because it's part of the pulmonary circuit. Deep within the heart, there are dense connective tissue bundles that form structural foundations, points of insertion for muscle bundles, and serve as an electrical insulator between the atria and ventricles that we'll talk about in the physiology of the heart. They provide an anchoring point.